Hello everyone, I'm Dr. Sitha Garg. So we have our specialist neurosurgeon, Dr. Sachin Bindal. He is Associate Director in Max Super Speciality Hospital, Mohali. So welcome sir. So we'll discuss about headache today. He is a visiting consultant over in our center, Zenith Healthcare Lab, every second Wednesday of every month. So you can visit and you can come and see him if you have any problems related to neurology and neurosurgery. So let's discuss about headache today. So sir, welcome to our lab and hospital. So tell us please about the headache, what are the common causes and what to do about it.
See, these days headache is very commonly seen in running kind of life. Everybody is these days very busy. And the first most common cause we've seen of headache is visual problems. Patient has got glasses because mobile use and TV use is increased, and the patient may have decreased vision of one of the eye or both the eyes. So that can be one cause. Second cause commonly seen is stress, and patients come to us, they say headache, and we ask them the history, and the history comes out as the cause is stress. Very commonly seen. Then decreased sleep, inadequate diet or delay in the taking diet, and even people they are not able to take adequate water. So second cause is that. Then there are pathological causes. Pathological causes like infection. Patient may present to us with headache, but the underlying cause can be an infection. It can be a vascular headache, like blood supply is decreased in the brain, or there is some bleed in the brain. Or the other common cause these days is tumor. The incidence of brain cancer is increasing these days because there is a lot of radiation around, lot of mixing of things like so many pesticides, so many fertilizers in our diet and insecticides in everything, and we are like consuming what we are consuming these days. We are not sure what kind of problems arise because of that. So these are the common causes.
So can we say there could be certain acute causes and there could be certain chronic causes? So when is an emergency? When to see a doctor immediately? Or when over-the-counter drugs can work, and then if necessary then specialist is needed?
See, 1 or 2 days of headache can happen to anyone. So over-the-counter drugs, like some people take some painkiller from some local chemist, that is not wrong. Some local doctor they can consult and they will give you some analgesic, and that can get corrected by that. Occasional headaches are fine. You can definitely take, as I said, stress is one of the common cause. You try to reduce your stress. You try to take adequate sleep, take food on time, take water on time, take some leisure time for yourself, spend some quality time with your family, so that will reduce your work. And other thing, as I said, the problem of vision, you can always get your glasses corrected. These are the common chronic causes, recurrent causes. So if somebody has got persistent headache, like recurrent headache, every few days person is having headache, every once the patient gets a headache, it stays for 2-3 days, 4 days, 5 days, that means there is some cause behind it. Then you must see a doctor who specializes in brain and spine. So the headache can be because of brain and sometimes because of cervicogenic headache also. So you should definitely try to meet a neurosurgeon or a neurologist for headache, because once you see a neurosurgeon or a neurologist, they will clinically examine you. They may be able to find out the cause, or they may get some CT scan or some MRI done. So these things, they help you to reach the cause, the root cause. If corrected, then yes, your headache can be, you can get away with it. Or if there is some tumor or some other infection or some blood supply related issues, then you can just start some medicine and you can nip the thing in the bud. So thing is, if you treat the thing in the beginning, then even the tumor, they are curable. If the tumor, if you ignore your headache and the tumor grows big, or it becomes some incurable cancer, or if there is some bleeding in the tumor, then you may just reach the hospital in a stage where doctor will say I can't do anything. These are the chronic thing. And the acute phase, as you said, acute phase is sudden headache, and you are like experiencing some weakness of one side of body or some paresthesia on one side of body. This is acute case. You have to immediately go to the doctor. Don't try to take any painkiller. Don't try to wait. Just go to the neuro specialist. He will immediately get a CT scan done and treat the acute cause, because acute cause, the golden hours, first 4 golden hours are very important.
Any particular comment on migraine kind of headache and also the headache related to hypertension? Because a lot of people are hypertensive, they are on drugs, but still there might be a symptom when the BP is shooting up. They might not really take that seriously, which can further lead to stroke as well. So any particular comment on that?
See, as I said, a lot of stress these days. Some people have genetic hypertension. They have to take regular medicine, and they have to do regular follow-up with the hypertension specialist, some MD medicine or some MBBS nearby. They are usually very, very helpful in controlling the blood pressure. Regular visits are required. You can have a machine at home. You can measure BP and just go and talk to your doctor. And if that doctor feels that it is related to brain, then you can they can refer you to a neuro specialist, or you can directly come to us to seek opinion that headache is persistent, BP is not getting controlled. So what shall we do?
Any basic investigations which patient should get done at nearby area possible?
See, as I said, vascular headaches are very common, infections are very common. See, all pathologists, they specialize in MD pathology, but they are basic MBBS also. So they have done all subject studies. They are MBBS. You go to MBBS for your basic treatment. A pathologist, he is MBBS, he or she is MBBS, and then they have done specialization in investigations. So they will definitely guide you what kind of investigation, like lipid profile, some thyroid abnormality, or they will just guide you this thing also, that you have vision issues. You go to specialist for eye specialist for getting your vision checked. So all those things, they can be guided by the local pathologist also. So you can come with those investigation to a neuro specialist. They will guide you ki what is the problem. Like if you have a high cholesterol, you will add blood thinners, or you will add some anti-cholesterol drug. And if you have some thyroid issues, you can add thyroid tablets. So all these things, they definitely help.
Thank you so much for the information. So please tell us where you can be contacted.
I am working in Max Hospital Mohali as Associate Director Neurosurgery, and we have lots many patients of headache coming to us, and we are able to treat majority of them if they come in the initial stages. So headache should not be ignored.
Thank you so much. Thank you everyone.